I don't do more on the PPT side because it's very complex and it is sometimes get not able to answer that what exactly I try to communicate to you. So when they invited me to talk about the health services, because I think about 2 years back I spoke sometime on their event in AP. It's the most complex things when you talk about ICT on the healthcare and a bottom-top approach. The problem out here is that from an IT side, because I spent a lot of my years in IT companies and then now about 7 years in telecom. The problem comes out of here is that when we talked about an healthcare services, the most of the data today are not digitized. So if I talked about threefold or fourfold of approach on these sections, one is that how do you identify what kind of a disease a poor or anybody has? That's one. Second is this asset management systems. Then the third is called patient management systems, where the patient comes and there's ID generated and do all these things over there. So today, we are trying a lot of things around here. We started off with telecom as a telemedicine, which runs somewhere, which doesn't run somewhere. And then we start doing something, a low bandwidth video conferencing, where we have taken it to the poor and try to have a video conferencing out there. Then we talked about the urban hospitals, about the asset management thing. So we have given RFID to tag their assets. So when the patients are needed certain things, the sister doesn't run from one end to another to find it out where the oxygen cylinder is there or some equipment is there. So he can check it out on his iPad or a computer which is available next to him, put that code and put that name. He suddenly sees that, okay, it lies on 7th floor in such and such department. So for my mind, when you talked about the bottom-top approach about the healthcare, the first thing is that you have to make a infrastructure ready about what you need. Because today, the services are available in cloud. The second, IP6 coming into the play now, most of the devices will be tagged with the IP. So when I talked about this IP is that, all of us in our urban class, I'm not talking of rural now, the urban class, we all work, our old parents or anybody in the house, we live with them. So the IP6, when it comes, it will come with a device with the IP numbers that are attached to this device. This works like a sensor. And the sensor are location based and it gives a pip every time pre-designed. So if anybody's father or mother is a heart patient, he can have it tied on the wrist and it will go on the web with the cloud and the doctor will get an alert if the pulse rate of his pulse rate goes up or she or he started feeling dizziness or she fall down, his doctor or her doctor get an alert immediately on the SMS. So, and then we connect that SMS to the critical ambulance, which can go immediately rush to that particular house because these devices are location based. So this is what I says that how you give a critical approach to the patients, and this is what I have suggested to your Max, and I'm giving them unofficially advice now. So we will doing a pilot on this. There are a couple of devices we have ordered from US. We're trying to test it out in the month of January. The second biggest challenge is that in healthcare services, be it in a government or in a private, about your supply chain management. That, when we talked about supply chain management, anything related to the healthcare, the medicines or the blood group or any kind of a thing with there is an expiry date, it's generally been attached. So they were telling me that they generally don't know that when this batch is getting expired because there is a bulk purchasing happening. So whenever there's a purchase happened, it became a barcode tagged when these systems are coming in within the system of there and gives you an alert when the expiry date before 15 days or 30 days, depending upon those medicines get expired, to tell you that what kind of a medicine they have to reorder or replace or whatever it means. The third is about when I say asset management, please don't mind, but I keep our asset as the most critical doctors also. So where are they, suppose there is a doctor who is a heart specialist or a cancer specialist or something like that, and suddenly a patient comes in and the doctor needed to be here, the person who are attending him or her immediately know the location of the doctor. Forget about the phone, whether he is going to approach in certain times or no. If he knows that, okay, Nivedan Sahani is just admitted and my doctor, Dr. Misra, is in Bombay, there's no point of searching him. We have to go and second go for that, Nivedan Sahani is in. But how do we help that Nivedan Sahani should not die immediately? The point is that if that doctor comes in, there are somewhere the electronic history has to be maintained. So today, most of the private hospital has digitized it. So what they want know from me, either my telephone number or my patient number. If I give it to them, they immediately start knowing that what's my history. What kind of a test I have done in the last 1 year, 2 years, what is the report Dr. Misra has given, what kind of a medicine he has recommended on it. So these are the things is really helpful to that. So when we talked about this IT infrastructure and IP6 coming with the equipments, asset management, these are the basic things which I say is the bottom. So when you go to the top, when I say bottom to top approach, then you know how quickly all this information you have to prioritize to make your patients or make your system work effectively. Because this is one area we really could not able to take any chances on that. So there are hospitals which are starting doing it, but I will slightly not favor the way the India has gone about the telemedicines or what they call it, that instruction of operating a patient through a low bandwidth video conferencing. There are many times people have showed me that, but it's too risky. I mean, whether doing it the condition which we have today. So what I feel is that the patient can be very comfortable if you adopt this ICT, which is very bare minimum doable, and make the life easier. So these are the couple of things which I wanted to highlight. We can keep on going on that with my experience. The second one which I'm talked about is your rural patients, which are actually far off. The government of India has started doing an initiative on that line, but it doesn't take off. They have tried it about 500 patients in Safdarjung hospital. They gave in a phone to particularly a person who go for a bypass surgery. The moment he goes, they give it a phone and there's a preloaded kind of an application is already done. So whoever is attending him, temperature, the blood pressure, wherever it goes, it gets feeded on that phone and it gets translated to the doctor in Delhi, who is actually looking at how the patient is moving and how his health is moving over there. So that's one end of talking of on there. The second end, the ICT gives a lot of advantage when we talked about the Anganwadi workers and the ASA workers in the field on the rural, where we have gone ahead and converted the entire application in a wireless devices. When I say wireless devices, it is machine to machine. So we give this mobile phones or the mobile equipment, wireless equipment with a preloaded application on top of it and bring all the information to a cloud, where the entire application reside there on the data collected. There is automatic computing of MIS report generated depending upon the language, because this phone is used to the people who are not English literate. So you have to do it with the localized language. So it comes to the cloud. From cloud, we do a lot of MIS report, and depending upon what the doctor want or what the administrator want, this MIS report can be changed. And those people who are going to access this information as given a authentication VeriSign keys. So every time the password and the login ID changes. So nobody can actually access the data to see, anybody cannot see the data. So these are the couple of things on the rural segment we are trying to do. So this is the overall scenario I can see is the top-bottom approach in the healthcare. Thank you.